Can prednisone cause teeth issues, dental pain, teeth loss, or dental problems? Hi, I'm Dr. Megan, your prednisone pharmacist. And this week I had oral surgery, and so I can't talk very well. But normally I do lots of videos all about prednisone side effects. And here's one that people don't talk about very often. And that's what prednisone can do to your teeth and to your mouth. So I get emails from people that mention teeth and it surprises me. Here's one of them. I was on steroids for 3 years. Now I have all kinds of issues with back pain. I broke my shoulder and lost 5 teeth. What can I do? Here's another one. My teeth are falling out and my joints are suffering. So people who take prednisone may not know and might be pretty surprised that their dental health is not what it used to be. And so some scientists did a study about prednisone and oral health, and they measured everything from x-rays to blood tests, and they looked at 100 people who took prednisone and compared them to 100 people who had never taken prednisone and didn't have any chronic diseases, like the people who took prednisone. And the people who were in the study who took prednisone took an average of about 7 milligrams a day, plus or minus a range, over a year. And so they tested the people at the beginning of that year and at the end of the year, all of those different tests to see what was the difference between people who took prednisone and people who didn't. And what they found was that people who took prednisone had a much higher rate of yeast infections in their mouth called oral candidiasis. And it was much greater. Like there was 0 people in the no treatment group who had yeast infections in their mouth, and a lot of people who had it in the prednisone treatment group. This is what they said. Evidence suggesting that long-term corticosteroid treatment may affect oral health adversely, leading to candidiasis, that's the yeast infection, as well as impair bone metabolism, leading to a considerable decrease in the mandibular bone mineral density. So their assumption is that the reason people might lose teeth is because of the bone mineral density of the jawbone, which is called a mandible. And they tried to find that in this small group of 100 people, but they didn't find it. Teeth loss is actually kind of not a very common side effect of prednisone. Bone loss is, but teeth loss is not. And so it was a surprise that they didn't see it for them. To me, I'm not surprised. I'm not surprised at all that they didn't see it because I don't hear of it very often. I much more likely hear of spinal issues like spinal compression fractures from the osteoporosis bone loss. I hear of broken wrists. I hear of other side effects. Broken teeth is not as likely. And so that's possible, but they couldn't prove it in this one study that they've done. But tons of people who do take prednisone have noticed this issue for themselves. So their recommendation is that regular dental checkup and measurement of the bone mineral density of the mandible may be advised for patients receiving long-term corticosteroid treatment to see any changes in the oral health status and to estimate the risk factors for osteoporosis. So that's what they recommended at the end of their scientific study, is that the most likely problem you're going to have is a yeast infection. It's possible to have broken teeth, to lose teeth. I've heard of quite a few people who've had this. Is it the tooth itself or is it the socket? Is it the joint where the tooth is going into your jaw? And that's the question no scientist has yet to answer. They need to do studies, and that's what they said at the end of this, is it would be really great if somebody could do that study in a bigger population. So it could be the bone loss, because prednisone causes so much bone loss. It could be the tendon, the ligament that holds teeth in place, that it's somehow losing its ability to do its job, or it could be the density of the jaw itself. One of those 3 things is what they hypothesized, but they couldn't prove with this study. So if you are struggling with dental issues from prednisone, if you're having huge, let's see what someone called it. They said the long-term side effect of prednisone bone loss makes your bones so thin that your bones can break, cause fractured vertebrae, compressed spine, lose height, sudden teeth issues, and huge dental bills. If you're having huge dental bills from prednisone or another steroid like it, then there's a few things we can do. So the two issues are yeast infections and bone loss. So what can you do first about yeast infections? Well, the problem with yeast infections is in your mouth cavity. It's called your oral mucosa, the soft tissue in your mouth. It can get a yeast infection that looks like little white patches all over, and they can be painful. They can make it hard to swallow food, to chew. And if that's the problem you're having, that means that the microbiome in your mouth is out of whack. That for some reason, the good bacteria, the bad bacteria, and the yeast are not in the right balance. And so the yeast is taking over. So one thing you can't possibly do is get probiotics that help put that back in the right balance. So that's kind of a natural strategy to prevent it. And I can recommend a few options below. In addition, they have prescription medications that can treat oral candidiasis, yeast infections. They have pills that you can take, and then they also have a swish and swallow or swish and spit, depending on where you're affected. When I was working in pharmacies, they would call it the magic mouthwash because it would have several ingredients to help coat your throat, to help it so it didn't hurt as much. And so that's a possibility. They also have lozenges that you can dissolve in your mouth that contain the anti-yeast medication. And so that's the best way to deal with the yeast issues. One more thing while we're at it is a lot of people who get yeast issues in their mouth are also using inhalers. And so if you happen to be taking prednisone and also needing to use an inhaler, if your inhaler also has steroids in it, then a really easy strategy is to swish and spit as soon as you're done using that inhaler. So something like Advair is a really common inhaler that has steroids in it. And if you're using that, be sure to rinse your mouth out after, brush your teeth after, whatever it takes, so that you're not leaving the steroid just coating your mouth, that all the steroid is going into your lungs where we want it to go. And so that is ways to help with the yeast infections in your mouth. And then let's talk about the bone loss. So bone loss from prednisone is a combination of factors. There's a lot of things involved. And some of the most important to consider are the loss of calcium, vitamin D, and magnesium. These are nutrients that are vital for strong bones, strong teeth. And if you don't have them in the right balance, if prednisone is making you pee them out or otherwise lose them, then you need to replenish. So a good vitamin nutrient repletion strategy is the best way to go about it. And you can just find calcium and vitamin D. That's a really cheap option, but it might not have all the bone building things that you really need, like the vitamin K2 and magnesium. And so what I did is I created a supplement just for people on prednisone, and it's called Nutranize Zone. And it has all the nutrients you need while you're on prednisone, including all of those to help support your bones. And it can help you support where you currently are to help so that we can prevent these horrible side effects from happening, that you can have the bone support that you really need while on prednisone, because you can't feel it happening until it's too late. So you can just go to nutranize.com. Signing off is Dr. Megan, your prednisone pharmacist.